Heart disease remains the leading cause of death across the globe. Understanding its early warning signs is not just important, it is critical for saving lives. This vital information is especially crucial for individuals over the age of 60. Heart attack symptoms in older adults are often much quieter and easier to miss than the classic dramatic chest pain many people expect. Recognizing these subtle indicators can make all the difference. Most people imagine a heart attack as a sudden, overwhelming event marked by intense, crushing chest pain. This dramatic portrayal is common in media, shaping our general understanding. However, for older adults, the signs of a heart attack are frequently less dramatic and can be easily overlooked or mistaken for other conditions. This difference in presentation makes early awareness even more essential. One significant early warning sign is unusual fatigue. This isn't just feeling tired after a long day. It's an overwhelming exhaustion from performing normal, everyday tasks. Simple activities like walking across a room or making your bed can leave you feeling completely drained. This profound fatigue indicates that your heart may be struggling to pump enough oxygen-rich blood throughout your body. It is a particularly common symptom for women over 60. If this type of exhaustion lasts for several days without a clear reason, it warrants a medical consultation. Another critical sign is shortness of breath. You might find yourself feeling winded after very light activity or even while you are resting. This sensation can occur hours or even days before any chest pain might develop. Unusual shortness of breath should never be ignored. If it feels different from your usual experience, or if it comes on suddenly, it is a signal that requires attention. Pressure or tightness in the chest is a more recognized symptom, but it can still be subtle in older adults. It might feel like a heavy weight, a squeezing sensation, or a tight band across your chest. This discomfort can also come and go, making it easy to dismiss. If this chest pressure lasts for more than a few minutes, especially if accompanied by sweating or nausea, you must call emergency services immediately. Do not delay seeking help. Pain in the jaw, neck, or back is another less obvious but important warning sign. Discomfort can radiate to your jaw, neck, shoulders, or upper back. This occurs because the heart shares nerve pathways with these areas of the body. This type of pain is often mistaken for muscle strain, arthritis, or even a stiff neck, particularly by women. It is crucial to consider the possibility of a heart-related issue if this discomfort appears without a clear cause. Nausea or a cold sweat can also signal a heart attack. This might manifest as a sudden wave of nausea, dizziness, or a cold, clammy sweat that appears without explanation. These symptoms indicate that something is not right within your body. Such sensations should be taken very seriously, especially if they occur alongside other symptoms like chest pressure or unusual fatigue. Your body is sending you a clear message. Lightheadedness or an unusual sense of anxiety can also be early indicators. You might feel suddenly dizzy or lightheaded, or experience an inexplicable feeling of dread or panic. Some individuals describe this as a sudden sense of doom. This can be a reaction to reduced oxygen flow to the brain. If you experience lightheadedness or overwhelming anxiety out of nowhere, sit down, try to stay calm, and monitor your breathing. Finally, swelling in the ankles, feet, or legs can be a warning sign. This fluid buildup in the lower body occurs when the heart is not pumping efficiently. You might notice your shoes feeling tighter than usual or see visible swelling in your ankles and feet. While not always indicative of a heart attack, it is a sign that your heart may be under stress. Regularly checking your legs and feet for swelling, especially at night, is a good practice for monitoring your heart health. If you experience two or more of these symptoms together, it is imperative to call emergency services immediately. Do not hesitate or try to self-diagnose. Prioritize calling emergency services, especially if you are experiencing chest pressure, significant shortness of breath, or a cold sweat. These combinations demand urgent medical attention. While waiting for help to arrive, sit down and try to remain as calm as possible. This can help reduce the strain on your heart. If your doctor has previously advised you to do so, you may chew one aspirin. However, only do this if it has been specifically recommended by a healthcare professional. Do not attempt to wait out the symptoms hoping they will pass. Time is critical during a heart attack. Under no circumstances should you try to drive yourself to the hospital. This puts both you and others at risk. Remember, quick action saves lives. Every minute counts when dealing with a potential heart attack. Heart attacks often provide warnings before they strike. Recognizing these signs early is the most powerful way to protect yourself and your loved ones. Taking proactive care of your body is fundamental to heart health. This includes maintaining a balanced diet and making healthy lifestyle choices. Stay active with regular physical exercise that is appropriate for your age and fitness level. Physical activity strengthens your heart and improves overall cardiovascular health. Managing stress effectively is also crucial. Chronic stress can negatively impact your heart, so find healthy ways to cope with daily pressures. Schedule and attend regular checkups with your doctor. These appointments allow for early detection of risk factors and ongoing monitoring of your heart health. Prevention is always better than reaction when it comes to serious health conditions like heart attacks. Empower yourself with knowledge and proactive steps. This message emphasizes the importance of early awareness and preventative measures. Every beat of your heart matters, and protecting it should be a top priority. We encourage you to share this vital information with others, especially those over 60, and with their caregivers and family members. Your awareness could save a life.